Brooklyn Independent Television.
Welcome to Healthbeat Brooklyn on Brooklyn Independent Television. I'm Dr. Monica Sweeney. Here's a summertime list: bats, baseballs, softballs, rackets, tennis balls, and badminton birdies. And let's not forget elbows and fingers. What do they all have in common? They can hit you smack in the eye. Injuries to the eye are very common, even more so when adults, and especially kids, are out in the warm weather, playing their favorite sports. We wanted to find out more about the nature of these injuries and how best to prevent them.
Hey, Doc.
How are you?
How you doing?
How are you, Mr.
Good to see
Hall?
you.
Good to see you today.
All right.
We're going to do an eye exam. You can come on over here.
Eye trauma is about 2 million injuries per year in the United States. Actually, about 100,000 injuries per year are due to sports-related injuries. About 40% of those are in kids 15 years or younger.
I was dribbling and I made a shot and it hit the basket, it hit the ring, and then it flew, it bounced, and it hit me in my eye.
Did it hurt you when it hit you?
Yeah, it hit me.
Basketball is not one of the highest risk sports. I mean, you can have a sports-related injury with virtually any sport, but most of the injuries are due to baseball and racket sports and hockey.
Okay, we're going to examine your eye now, okay?
Okay.
Baseball in particular, it's a high-impact injury generally. It's a pitcher being hit with a baseball at a short distance with high velocity, or it's a child fielding a ball in the infield or in the outfield. And so it tends to be fairly high impact injury, so there's significant trauma to the eye. As far as racket sports, it's not uncommon to have someone swing the racket and accidentally hit the other player in the eye. And that again is a pretty high impact injury, and it's pretty high velocity.
Good. And I want you to look straight ahead over to here.
So we see many different types of trauma. If the trauma is significant enough, it can cause a cataract from the severe nature of the injury. We get fingernail injuries to the eye that can cut the front part of the eye, called the cornea, which tends to heal well but can be a problem for some people. We see patients that have bleeding inside the eye, something called hyphema, and that's actually very common with any type of significant trauma to the front of the eye. And we also see worse problems. We can sometimes see a rupture of the eye, a so-called ruptured globe or ruptured eyeball. And those tend to cause very serious permanent loss of vision. You can also get damage to the back of the eye where the retina is. You can have a tear in the retina, or you can have something called a retinal detachment.
Were you wearing any goggles on your eyes?
No, I was not wearing any goggles.
Many of these injuries, probably up to 90% of these injuries, could be prevented with the use of goggles. However, maybe 10 to 15% of kids are actually wearing protective goggles when they play sports. Adults who sustain quite a bit of injuries as well with sports only wear goggles about 20% of the time. Most people find them cumbersome and inconvenient.
Look straight ahead, open widely.
Many of the injuries we can treat if we manage them early enough. One of the problems is patients don't always come to the doctor right away after an injury. They think it's going to get better, and sometimes if you wait, it's harder to treat these and manage these problems. So I would recommend any loss of vision, decreased vision, any double vision, any severe pain in the eye, anything that feels abnormal with the eye should be evaluated within the first 24 hours.
Good. You can sit back.
I think there's no problem with playing sports, and I think it's healthy for children. I think if you want to reduce the likelihood of sports-related eye injuries in kids, you have to consider wearing sports goggles. They're made of a particular plastic that is impact resistant. And so if you wear those sports goggles that have a polycarbonate plastic that doesn't break, you can probably prevent about 90% of eye-related injuries in children related to sports.
So you got to be careful. Basketball is a great sport, but there are a lot of injuries associated with it. But fortunately, he's just fine.
Okay, good. Thank you very much.
It's good to see you.
Brooklyn Independent Television on the BCAT TV network.